process of gallbladder removal, also known as laparoscopic gallbladder surgery or a colonoscopy, is very interesting to see. While observing the whole procedure, it is a very unique way to see the body in a different way from the inside. This process usually lasts for about 2 hours, but at the end you end up with a small organ the size of your fist or smaller. This surgery is very important to see. This surgery is very important to take out the gallstones, or if you have problems with indigestion, infection, nausea, or vomiting that are constant. Also pain after eating, or if the gallbladder is just not functioning properly. In high school, I was in a special program which allowed me to go into surgery rooms and observe this procedure or various others. The process of gallbladder removal is in 3 processes: the before procedure, the during, and the risks. Okay. According to Medline Plus, the surgeon may ask the patient to have tests done before the surgery, like blood tests, x-rays of the chest, or x-rays of the gallbladder. The week before the surgery, the patient may be asked to stop taking drugs which would cause the blood to clot. On the day of the surgery, the patient should not eat or drink anything after midnight the night before. The surgeon will also prescribe drugs which will help during the surgery and after the surgery to help the patient recover. Okay, during the procedure, according to Medline Plus, the gallbladder is removed by having the person be under general anesthesia, which usually means they're fully out of it and are pain-free. The surgeon will then proceed to make 3 to 4 cuts in your stomach, which can be seen by the picture on the top. And then the surgeon will proceed to put in a microscope, which is a thin lighted tube which is attached to a video camera in order to see the insides, which is this part. It will be inserted through one of the cuts, and the other cuts will be other instruments which the surgeon will use to cut through the fat and skin, and also the blood vessels. The gas will then be pumped into the stomach in order to give more space to work and see clearly. The surgeon first cuts through the fat to clear away in order to see the blood vessels and bile duct. Then it will proceed through the bile duct and blood vessels that lead through the gallbladder to be cut. The gallbladder is then removed with the laparoscope, and the bile duct is clamped shut. You take out this and just use this clamp to cut through this vessel, and then it's stapled shut. The gallbladder is then removed with the laparoscope, and the bile duct is clamped shut. An X-ray called a cologram can be done during this procedure. It involves dye being squirted into the blood vessels in order to see if there's any gallstones or if there's more veins connecting through the bile duct, which would cause bile to seep through the vessels in the stomach. The patient is then stitched up and taken to another room to rest. The risk, according to WebMD, is very low. However, there could be some problems. Infection. Oh, sorry. This is how the gallbladder is taken out. They squeeze it through one of the incisions with the clamp. Infection of an incision can be one of the problems. Internal bleeding, inflammation in the pancreas, injury to the small intestine, or the common bile duct. Other complications are the bile leaks in through the stomach, which cause severe damage. Injury to the blood vessels that carry blood from the heart all the way to the liver. And also pain in the stomach, bloating, gas, and diarrhea. The general anesthesia can also have risks such as reaction to the drugs taken after the surgery, breathing problems, and pneumonia, which is an infection of the lungs, heart problems or blood clots in the legs and lungs. In conclusion, gallbladder removal surgery is very interesting to see. For me to be able to observe and ask questions to the surgeon is a very high high accomplishment. Uh, there's the 3 steps, which are the before procedure, the during, and the risk. In another word of caution, according to Medline Plus, the surgeon sometimes cannot safely take out the gallbladder from none of the cuts. So in that case, they have to perform an open colonoscopy, which requires the surgeon to make a large cut across the stomach and reach in and take out the gallbladder by just moving around the organs. So, thank you.
All right, thank you. That's all that we have time for today. One last reminder, if